We're Team Caretinue, connecting post-hospital care to enhance health outcomes. Meet Emma, an 85-year-old woman who's just been discharged from hospital. She lives alone and her caregiver is having problems understanding the instruction given to her upon discharge. Emma's at risk of missing her follow-up appointments, not receiving necessary medications, and being readmitted. Medicare estimates around 2 million readmissions annually, costing $25 billion, of which $17 billion are avoidable. A recent survey we did confirmed that half of the new information from Discharge is lost within 24 hours of receiving it for various reasons. Most people would prefer receiving this information on an app that can be easily shared with caregivers and clinicians. Our solution gives room for both hospitals with EHR and those without. With the aid of optical character recognition using the Google Cloud Vision API, a paper-based discharge summary could be scanned and interpreted with the NLP API for the patient's use on the app. For hospitals with EHR, the Healthcare API with FHIR provision allows for integration with EHRs to display a discharge summary. For our patients with language barrier or poor vision, we plan to incorporate Google Translation and Google Speech to Text. With Caretinue, the possibilities for integrating Google Cloud APIs are endless. In our app, patients can access their profile and give access to their caregivers, enabling family to stay connected with the patient. Through reinforcement learning, we can push notifications to our users, sending reminders to take their prescribed medications. There's also a list of self-care tasks based on the patient's diagnosis, and patients can view and edit follow-up visits and track their daily progress. Our stakeholders include patients, their caregivers, physicians, hospitals, health insurance companies, and government payers. Caregivers can be granted access to the patient's information, which enhances collaboration and health outcomes. The current options on the market fall short of being interactive, easily accessible, and digital. We have a timeline that predicts that our second MVP by the end of this year and an exclusivity contract which provides rollout in the second quarter of 2022. As part of the EHR industry, we can expect a compound annual growth rate of 5.4% in our market. Audio revenue includes collecting a percentage fee from increased hospital reimbursements and advertisements. Caretinue will enable reduced hospital readmission rates, thereby saving money for insurance companies and hospitals. It will also improve patient health outcomes. Under the CMS Hospital Readmission Reduction Program, hospitals are reimbursed for lower readmission rates. Our fee will be charged from the improved reimbursement rates. Caretinue will also help insurance companies avoid increased claim costs, and a percentage of these savings will be charged at our fee. Lastly, vetted service providers will advertise on our platform.